Thank you everyone for joining, and we have with us Adam today. Adam brings, I have his intro right here, 15 years of technology leadership across healthcare, real estate, entertainment, and other sectors to Med Ally. Am I pronouncing it right, Adam?
Yeah, yep.
And he's founded Med Ally to help physicians with concierge medicine, which is pretty interesting. I learned about it through him, through strategic guidance, technical excellence, and partnership focused support. And with that, the mic is yours, Adam. We will take a quick picture right after Adam completes his talk, and then we'll open up for Q&A. I will try and wrap this up by force, just 2 minutes before the ending time, so that everyone gets to leave on time. And hopefully, once we have a Slack channel, we can continue these conversations asynchronously. And with that, sir, the mic is yours.
Awesome. Yeah, so my name is Adam. I'm with Med Ally. I'm the CEO and founder. Basically, we work to help doctors convert to concierge medicine. We work with existing doctors or doctors that might be trying to go into concierge medicine. And of course, that means we have to deal with healthcare data. A big part of that is actually looking at patient data. We'll commonly deal with a lot of patient data because we have to look at their eligibility of whether they're actually going to be eligible to be concierge, which often is going to just come down to demographics, income, things like that. But usually there's a lot of data enrichment, a lot of data passing during the eligibility window and period. And so it's very important to know how to handle data correctly. And I came from originally an IT background, so I had a lot of expertise in, dealing with networks, servers, data encryption, all these things. So I just kind of want to go through just kind of like a general talk about HIPAA in the healthcare context and show you, what that's taught me. And this is kind of like an overview and best practices, because I'm sure a lot of you have already heard of HIPAA and kind of know the general gist of it. But I think this can be kind of a good little overview. So I'll share my screen here and just let me know if you can see these slides here.
We can.
Awesome. So yeah, so AI data handling and HIPAA. So I'll keep this short and sweet. But basically, we all know that HIPAA was a privacy law that was passed, I think, in around 1996, and changed healthcare pretty fundamentally. I think there's a lot of graphs that have been circulating around on X and stuff, talking about why healthcare is so expensive. And a big part of it is, of course, the administrative cost and the compliance requirements. And a lot of, to be honest, businesses now exist because of those requirements and all these administrators and hospitals that have to be in compliance. And so, of course, that increases the cost of healthcare, but it does theoretically make the quality better. So we just want to kind of go into HIPAA risks here and just looking at what is practically, realistically does happen. So what is the actual risk here? So when you look at the actual law, you can have penalties that go up to $64,000 per violation, but that's an up to. So I kind of included a little visualization here. But just to know, realistically, as long as you're reasonable and you make a good effort, the government's actually pretty reasonable, so they're not gonna, if you're just ignorant or you didn't know better and you do remediate it quickly, typically you're not gonna be facing serious fines. So it's really just about, where can I make it the most impact? If you're a startup, you're just starting out, or you're, a smaller business, you have a limited budget, you just really need to focus your resources towards where can I make the biggest impact in terms of my HIPAA risk and reducing it. So of course, fees are capped up to $1.9 million per year. I'm sure most people would not be anywhere near that, but I think penalties start around like $140. So the smallest violations are pretty reasonable. And realistically, you probably wouldn't be discovered, but it is good, of course, to actually handle these because this could wipe out your business if you don't take it seriously. But, because, if I found out my data was, exported, I would be happy to sue someone, and I'm sure most people would feel the same. So, there's definitely a real risk. So just looking at the sliding scale here, again, if you're willfully neglectful and you don't remediate within like 30, I think it's 30 to 60 days, then you can be fined up to $64,000 per violation. So that's a real risk. So you need to understand that. And then that can accumulate. So, if you have lots and lots of customer records or there's specific instances and cases of, some portal that was open or something, then it can potentially go up to it can accumulate to up to $2 million. So that's like a serious risk to your business. So, just recent examples here. We have Deer Oaks. I believe this was in 2023 in San Antonio, Texas. Actually, I think we have someone here from San Antonio. So, it's this was a portal, basically a portal where electronic PHI was available publicly. So I guess somehow people could get to a link that they shouldn't have been able to get to see notes. So they had to pay 225,000. So, that's definitely not chump change. I think I don't remember the size of them exactly, but I don't think they were huge. So I'm sure it hurt them. And then we had another case of this was actually a CPA firm. So this CPA firm, they had to pay 175,000. So this was actually interesting because they were actually just a business associate. So this also shows that even if you're not like the core, you're not dealing with the core clinical data, if you're just involved transacting with another healthcare company and you happen to hold on to patient data, that you are just as responsible. So if you're an entity or you're a support organization working in healthcare, with doctors, practices, health systems, whatever, you do need to be in full compliance. So this applies just as much to you as it would anywhere else. So they failed to conduct a proper risk analysis, meaning that they never really put in the proper controls and measures in place. So that's just kind of laying the scene, what's more recently, and these are up-to-date fees. So this is as of the latest laws and enforcement from the Department of Health and Human Services. So just going, looking at the actual best practices before we get to our demo. Um, you definitely want to do an annual risk analysis. You want to conduct security and HIPAA training with your staff. That should be an ongoing theme. I mean, typically, you do that when you initially onboard, and then every once in a while you'll have recurring cyber training or things like that. Uh, you'll definitely want a remediation plan, right? What happens if there's a breach? Like what happens if, everything like you find out that some CSV or something had a bunch
Mm.
of information in it. I mean, you potentially might have to contact that practice and let them know. So I mean, usually transparency is best, but first you need to figure out what happened, what's the risk, what was exposed, then communicate. That's why, some delay is usually expected. But you don't, the longer the delay, the more distrust. Um, Two-factor authentication. I don't know if anyone here is using two-factor. I'm sure you're using them with your banks, hopefully, and your brokerage accounts or, your financial stuff. That's very important. So, just like you'd protect your finances, you should take the same approach when you're dealing with healthcare data and patient data. Least privilege, so this is pretty common. I mean, anyone that works in IT will know about this. Audit access logging. So if a breach does happen, how do you know who got access to what? So if you don't have all those things turned on or you don't know how to turn them on, that's
Oh,
where you might want to engage and consult with someone that knows how to do that. PHI stored with vendors, so you only do business with vendors that can actually be compliant with HIPAA and are actually willing to sign a business associate agreement with you, where there's basically a shared risk and shared understanding of that compliance. And then just going back to the data at rest versus data in transit. So these are kind of like two fundamental concepts when you look at data handling in general. So you have data at rest, which is just data that's like, think of it as like storage. I'm just putting it here in the fridge and it's going to sit here for a period of time. And then data in transit. So, if I'm sending like something in the mail, email, whatever, that's all data that's basically could be exposed. So am I properly securing it for email? Do I have TLS enabled? For if you're going to a website, do I have HTTPS? Which pretty much, if you don't do that now, a browser will give you a warning. So most people have it now. But is your certificate signed? There's all these different risks. So VPN, definitely if you have employees that are working and traveling, they should be using a VPN. They shouldn't be connecting to Starbucks, directly if they're dealing with any sensitive data. Um, automatically locking PCs. So these are all just standard cybersecurity best practices. So just I'm going to stop sharing this and I'm going to do like a brief little demo here. So what I want to show you is basically I'll share my whole screen here if I can find Zoom. Okay, so basically what I'm showing you here is this is LM Studio. So LM Studio is essentially think of it as like a local chatbot that you can run, and you can run like any type of large language model, word that I'm sure we're getting tired of hearing at this point. But basically, it allows you to download lots and lots of different models. If you go into this little folder here, there's basically like a marketplace. It integrates directly with Hugging Face, which is becoming essentially the marketplace or the place where you can get large language models that are open sourced and have licensing that allows them to be redistributed. And if you anyone can download it. You can actually run it on Mac. You can run it on PC. This is actually a super useful tool. I found it to be probably one of the easiest ones that you can just use out of the box. Um, they have a tutorial, but if you use it by default right now, it will default to ChatGPT's open source 20 billion parameter model, and it actually works really well for most general purpose uses. So I would probably recommend, if anyone wants to give this a shot, just go to Google LM Studio, download it, and I would just use their recommended base model. It's pretty good for general purpose use. But basically for us, we deal with patient data all the time, and sometimes we may be creating certain lists for different purposes with select pieces of patient data, and oftentimes it can be very useful to obfuscate data. So we might anonymize data, like anonymizing potentially some of the fields in some of the data, or potentially redacting things just to keep the data safe so we can handle it, like in maybe with parties that we're not compliant with, or maybe because we're doing training on the models and we want to remove anything that targets directly to the patients because we want to we want to learn something interesting about that data, but we don't want anyone to be exposed to it in the future. So we can create like training sets. So one way to do that would be to just literally just take the data. So here I don't know if you guys can see this. Can you see the screen here? This little spreadsheet? Awesome. So basically, this is just like so obviously I'm not sharing real data. This is a fake data set. But this is what looks like might be like what you would typically look at for a patient demographic. So most EMR systems like that, any practice or health system would work at would have something like this. And at MedAlly, this is pretty common for us whenever we work with doctors and look to see their eligibility for concierge medicine. We'll typically deal with these. So here I'm just taking kind of like an example of a couple of records here, and I'm literally just copying them. And then I'm going into LM Studio and I'm saying, hi, I have some records here, but I want to omit any data that might be confidential so I can share this. Can you remove uh, any PHI? Let's just say any PHI. And then I'm gonna just add an extra space there, and I'm literally just pasting the raw text, right? This is running on my computer, right? So this is not going out to the internet. This is not going to ChatGPT servers or cloud or whatever. This is literally just a file I downloaded on my computer. I'm running this model, so it does take a while to load the model. So I loaded it just for the sake of time for this talk here. And they can take a bit time to load open because they're big files. You're talking about like a file that might be 12, 16 gigabytes, right? So just to run these files, you are going to need a fairly sizable laptop, but let's just run this here just so you can see it. So here I am, I'm literally pasting. Now look at that. Now this thing's running insanely fast. This is like just like a lot of technical progress in like a very short period of time. But basically, you can see here, it's basically summarizing it. It's basically taking out all the less personalized information. So just like generic information about the demographics. So this might be useful if you're trying to do some sort of marketing thing and you're trying to target specific areas or something. There's lots of different use cases for this. But you can see here how quickly it went through and it basically created a table of just the information. So you could obviously manipulate this in a million different ways. Just keep in mind there's a limited context. So if I click up here in LM Studio, you can see there's the model here. There's actually parameters that you can do. So you can load the model with different context sizes. And context size is just how much data can I give you until you get overwhelmed, right? So it's pretty easy to think about, but this is super useful. I mean, anything you can think of, or if you're at an airport or somewhere with bad Wi-Fi, this is a good backup if you just need like some, a little chat GPT that you can run. So that's basically what this is. I have used this from time to time when there's certain privacy prompts that I'm trying to do that make me, a bit concerned or hesitant. So I definitely encourage people to try this. If I would recommend though you have a computer that has at least 24 to 32 gigabytes of memory. In this case, I'm running it on a MacBook. It runs much better on MacBooks since they use unified memory, meaning that they share the same GPU and CPU memory, which apparently large language models really like. And this is a pretty powerful MacBook. But if you ran it like on a maxed out MacBook Air, it would probably work fine, which is about 24 gigabytes of RAM. But yeah, so that's pretty much. I don't want to. I mean, I want to leave plenty of room for questions or anything. But that's basically how easy it is now today to run a large language model and locally. And I definitely, encourage people to try it. It's pretty easy if you have a computer do it. It can be fun just to like noodle around with it or ask it questions and see what it can do. Um, general day-to-day use, I still recommend using the real, hosted models if you're trying to do like a very like difficult or complex work, since they're still going to be better. But be very mindful before you're ever pasting anything. If anything, oftentimes using something like LM Studio as an assistant to get the data ready and then pasting it into another one, that you could do something like that, a workflow like that, but you need to be mindful of reviewing the data before you actually post it, because you would be liable if something happens, even if, cloud or whatever got access to some data and then one of their engineers did it. If they can trace it back to you, they can, potentially you can be the one that's liable for it since you originated it. So, I mean, in practice, a lot of times you're not going to be, if you make a reasonable effort, the government seems to be pretty willing to work with you. So I think as a business person, if you're reasonable, the fines are probably not going to be terrible. Yeah, that's pretty much what I got.
Thank you so much, Adam. Let's open up for questions.
Yeah, 18?
Hi. I My question is not about HIPAA, but you got me very interested with the local LLM stuff.
Yeah, yeah, yeah.
And just wanted to put out. I mean, I of course also have a Mac, and I find it very simple to try the local LLMs. But I just wanted to put out a word of caution for people who might try this on Linux or on Windows. You have to spend a lot of time setting up the GPU and CUDA, etc. I mean, my Mac, when I got it in the mail, within 2 hours, I was running Olama and I was running models because I had zero fiddling with software. So
Exactly.
especially locally, if you are planning to experiment with it, it's worth spending the money to get a MacBook Air with 24 gig, and you'll be able to run these models which are quantized. But second question: did you try any other models besides the OpenAI ones?
Yeah, yeah, I played around with some other ones like Quencoder. There's
Yeah,
some other like distilled versions. Like there's the I'm trying to remember the name of that. Those guys that do the distilled models, but they often will create models that are that use less resources but don't
yeah.
sacrifice much of the accuracy and precision. I wish I could remember the name of them now, but they do it for pretty much most open release models. So oftentimes I'll take their version and that's a little bit more fine-tuned, but loses a little bit of the accuracy and try those. There's also some um, yeah, I think it was mostly Quen. I tried Quen, the Llama 3.1. I've tried a couple of them. It just as they get smarter, everyone just switches to the smartest one pretty much, right?
Yeah.
So right now the ChatGPT one seems to be the best general purpose one. I think the file itself is like 12 gigs, so it
Yeah.
seems you
Yeah.
can run that on like a
Yeah.
MacBook Air, which I think most people can probably afford. So
Yeah.
it's pretty. The main reason is with the MacBooks is the unified RAM. There is actually a AMD computer now that does have unified RAM also
Yes.
that potentially if people prefer Windows, I don't remember what it is. It's like the HX something AI Max or something.
I just saw something about it. It's like a sticks something or the other, and but you still have to deal with the CUDA stuff, and you still have to deal with the
Yeah,
setup.
exactly. If you
You
just
know?
I mean, if you value your time, just pay the
Yeah.
Apple tax and get
Yeah.
it over with. Yeah.
Just
The other question
quickly
would be: have
jumping
you tried
in.
Olama?
So
Have you
sorry,
tried?
Nathan. There are three
Yeah.
other questions.
Oh yeah. Sorry.
I can cycle back to you.
Okay.
Sorry about that.
No, no,
Uh,
no problem.
Mike, Linda, and then Sherwin. please.
Sure. So
Let's try and do like 1 minute per question so that everyone gets covered. Go ahead.
this one might be pretty quick. I'm curious, Adam, do you think that a lot of the general purpose online AI tools are going to start to, I'll say, even reject PHI being entered into the prompt?
I mean, it depends on if how they can do the systems or system prompts, or if they create like little models that then, because what I think a lot of the multi-agent stuff they're doing is they're creating models that will try to predict what type of request and then route it to another model. So maybe if they start prioritizing that, I think it's just going to be reactive, right? Someone's going to do it, and then there's going to be a problem, and then some engineer's going to build a specialized model to deal with that problem, so it doesn't happen again. So I think it's just when is someone going to do it with ChatGPT? And someone is. So it's
Yeah.
just we're just waiting for it.
Okay. Linda, you're on mute. Sorry. Linda, you're on mute. Sorry.
Oh, Linda, yeah, Linda, you're muted. You're muted. I can't hear you.
So sorry, forgot about that. Can you talk a little about state variations, particularly if MedAlly works in different states in compliance and privacy? And also, can you talk about high tech, which I think is stronger than HIPAA or brought additional protections?
Yeah, I mean, I've more generally followed. I've reviewed high tech a little bit, but honestly, I couldn't tell you like the specifics of high tech. The multi-state stuff. I mean, I go based off of usually the cities, like the more concentrated urban areas are going to be more stricter, like California, like New York. I mean, Florida, like kind of in the middle, Texas, maybe not as strict. So it's just depends on the state. We really just do it on a case by case basis on that, but we just follow the general principles and usually just start with most restrictive and just assume the most restrictive and assume that they're very penalizing. That's why I prefer to just take a very paranoid approach, because trying to be in compliance with every state, we do that more when we're dealing with contracts and we're looking at actual like, okay, what's the actual risk? And but to be honest, my legal expertise is limited.
Okay, thanks.
Sherwin.
Yeah, appreciate. So that was helpful. Maybe two questions. One is brief, is basically the 500 patients, data breach used to be a very big deal a couple of years ago. But now I just did check, when you were talking, and it looks like it's just mainly informing, those patients, and that may be it. Aside from the penalties you shared, I'm just confirming that. The second point is, whether or not you have seen a progress in terms of moving from the gray area when we talk about HIPAA guidelines to at least some black and white kind of decisions, which was prohibitive historically from data sharing point of view, and a lot of decision makers were just worried, so they were getting overprotective. But at the same time, I do see more progress, small but meaningful progress in the past 3 years in terms of data brokerage. I'm aware of the entities in US that are selling anonymized data outside US in terms of health. So there should be some better understanding of what amount of HIPAA sort of a compliance is sufficient, so that decision makers deal with that easier. Have you seen anything specific in the past 2 years? That's a question.
Not necessarily. I mean, my experience working with different organizations is that some can be very heavy on the compliance and very restrictive and have very onerous administrative like procedures that have to be done, especially when you deal with hospitals, health organizations. They're usually going to impose those type of rules, and I think there's a good reason for it. But usually, when there's a delay, then I think it's not reasonable. Like if you have to wait a whole week just to get a simple report or a list, that's usually a technical problem, and it's usually just, the engineers and the IT people fighting with the administrative people that are worried about the HIPAA risk. Just coming, like looking at it as an engineer, I think that, a couple of working days is usually reasonable, but if it takes you a couple of weeks just to generate a simple report, then that's more an organizational issue to me, an operational issue. Of course, looking at the data sharing and the data broker stuff, you have to be very, we're looking at data policies and stuff. I think it's very important to be transparent. Are you selling data? Are you not selling data? data, what constitutes one of the problems with HIPAA, I think, and the arguments that you've seen a lot is that you can actually often look at healthcare data and actually constitute it or classify it as marketing data. So sometimes there is some overlap, and you could say, well, no, this is actually not PHI data. This is actually promotional information that we're just using, and we're just marketing to these people that happen to be patients, but those patients are potential customers. So you can, in the court of law, there have been arguments, I guess, that have been made. Again, I'm not a lawyer, haven't gone to law school, but I know just working with people that have drafted documents and stuff that has been an interesting distinction between marketing and PHI, and it can be made in court apparently, but I would definitely consult with an attorney that has more understanding of all these rules that Congress has created for us.
There was just so much interest. I couldn't end the call earlier. If someone wants to drop, please do. But I'm going to let Nathan, since that's the only question left. Adam, I hope you have time. So
Yeah, absolutely. I'm here.
Nathan, please, your question, and then we'll end.
Thanks for your time, Adam. Very informative. Do you have any familiarity with any of these HIPAA compliant SaaS AI services that do support signing BAAs and entering contractual agreements to process health PHI?
Not really. I mean, we actually built our own. We have our own signing process. We basically integrated it with the document signing API, and then we have our own. We handle all the data storage and everything ourselves through Google Cloud when we signed a HIPAA agreement with them. So we're pretty much, we're trying to do things. I mean, we are one of the reasons our pitch to doctors is that we offer really low cost of service. So to be able to do that, we've integrated a lot of things in-house. And that's one of the big advantages of AI is you can write a lot of software yourself. And I think a lot of these tools could be useful for companies that don't want to do that. To me, there's a lot of tools out there. So, but I actually think they could be absolutely valuable. For us, it just made more sense in the whole pipeline and the process of sending contracts, BAAs, to just do it all ourselves through the software.
Thank you.
Okay. Thank you so much, everyone, and Adam, especially you. And with that, this is a wrap.
Great talk.
Awesome.
Adam.
Thank you so much.
You.
Appreciate it.
Bye-bye.